Welcome to ADHD as we're sharing knowledge about the basics. These are just basic information. Today we are busy with episode number, apologize, excuse me, episode number 9. We just got 3 more left, inshallah. Alhamdulillah. So ADHD, main thing we are sharing knowledge to remove the stigma about ADHD. Let's get together. What about ADHD symptoms in toddlers and young children? This is mainly specific for first world countries because they pick it up early, but just for completeness sake, I'm just discussing this. While most doctors won't diagnose a child with ADHD until the age of 4 years, some kids may show symptoms before then also. So most ADHD symptoms look a lot like typical toddler behavior. So it looks like, there's nothing wrong with the child. Let the child grow out of it. It's milestones. But there are some potential signs. So in this case, they often get into trouble at preschool or daycare. So usually at preschool or daycare, children are very obedient. But if you find that 1 or 2 children, this one is a bit difficult. Then okay, that could be a potential. That's a red flag. Okay, because most children at that age are very, very obedient. So it is fine that in preschool or in kindergarten, they are causing problems. Okay, then that's a little bit of a red flag. And you find that the behavior is different from other kids. Other kids are very obedient. They're not hyperactive, all, but this one is a bit of a jumping fish. Okay, so research has shown that children with ADHD may have differences in areas of the brain. We mentioned the executive part of the brain that controls social skills, attention, and movement. These are the motor cortex. So there's difference in the areas of the brain. So basically, it's to do with the brain. Okay, it's a neurodevelopmental problem, and it's got to do with problems with chemicals in the brain. There's chemical neurotransmitters, there's electrical neurotransmitters. So it's a major complicated scenario. That's why it takes a whole team to try and come to a specific diagnosis for ADHD. Experts believe that the brains of children with ADHD tend to mature later. So sometimes give your child a chance. It's just milestones. They will maybe grow out of it. So don't be too hasty and don't feel low esteem. Okay, don't feel that there's something wrong with you as a parent. Let's remove the social stigma first and foremost from our own brain. Don't think there's something wrong with us or there's something wrong with our child because our child got ADHD. No, don't blame yourself as a parent and don't blame the child. So, because that child could grow out of it. Have patience, give positive reinforcement, support the child, and be confident. Don't try and hide your child to say, no, is something wrong with this child, or let's not take him to social function. Take him everywhere. Let the child become confident. And whenever there's any bullying, let the child tell you immediately, this one is bullying, or this one insulted me, or that one mocked me. And then you sit at home, you discuss ways of how to managing those situations. Okay, so what about vaccines? What about that in ADHD? Okay, so here's what studies have found. Research has shown there is no evidence that ADHD could be caused by sugar. Sugar does not cause ADHD. Vaccines do not cause ADHD. Poor parenting does not cause ADHD. TV does not cause ADHD. Video games do not cause ADHD. So let's be very, very clear on that. But there are risk factors, as what we mentioned before. Let's remind them for completeness sake. Risk factors are alcohol or tobacco use during pregnancy, premature birth, brain injury. Sometimes when the baby is being born, there's brain injury. There could be oxygen deficiency because the umbilical cord is around the neck of the baby. This can cause oxygen deprivation in the brain. That could cause some risk. Exposure during pregnancy to the mother to certain environmental problems like lead and low birth weight. So these are just some of the risk factors. For children under 6, behavioral therapy is the recommended treatment. If a child is under 6, don't take drugs. Just do behavioral modification. As they grow older, depending on how they cope, maybe their medication need. But when they're young, just do behavioral modification. A therapist or counselor can teach children techniques. So you must have a counselor or therapist to teach you the techniques for behavior modification. They can also teach the parents, teach the teacher. Teachers must be involved also. Take the teacher also for training courses to help manage the child's behavior. Must create more structure, clear expectations, encourage routines, and you must reward good behavior. Please, I cannot emphasize it enough. You must encourage good behavior, and you must discourage bad behavior. But discourage with diplomacy, and don't scream at the child, don't yell, don't punish. If there's bad behavior, then do it diplomatically, but do it with clear rules, and to say, this is not acceptable. This is not acceptable, right? In that way, in the tone, but not to scream or do corporal punishment. All of that we avoided. So drug treatments, a class of drugs called psychostimulants. Sometimes just stimulants are an effective treatment for many children because we know that they are a bit on the low side. So you can give them psychostimulants to boost them up. These medicines help children focus. They focus their thoughts and ignore distractions. Some non-stimulant medication may also work. So some stimulant drugs. So please note, I'm just giving general guidelines. I'm not telling you to use these drugs. Any medication you take, you only take it under strict supervision of your psychiatrist or your doctor or your pediatrician. What I'm telling you are just general recommendations. I don't know you. I don't know your patient. If I haven't examined anybody physically, I don't give no recommendations. So what I'm just telling you are what studies have shown, that these are just general guidelines for you to get an idea if the medication you are taking is the correct one. If you have any doubt whatsoever, please speak to your own doctor, because your doctor knows your personal history. So let's go through this list. Please remember, don't say you've seen this medication and you're going to take it. Please don't do that. I'm not encouraging anybody to take any medication. And even if I give medication for diabetes, don't take it because I'm saying it. You only take medication if your doctor tells you. If a doctor writes out a prescription, and the doctor must put his signature on that to say, I have examined that patient and I am giving you these medications. That's why I'm just giving a general guidelines. Whether it's my program or anything you read on the internet, don't read on the internet, because there are 14-year-old boys with acne on their face who are pretending they are doctors and giving out rubbish advice, and they are harming the people. So please, anytime you put anything into your mouth, even if it's herbal medication, don't put nothing into your mouth. It's your mouth. Look after it. It's your body. As what I said many times as well, don't put rubbish into your brain. Don't put nonsense into your brain. Don't take a social media and put nonsense into your brain, and don't put rubbish into your mouth unless you have gone to a professional expert and they tell you if this is good for you. So please don't put rubbish into your brain by nonsense that we see, and don't put rubbish food into your mouth, and don't put wrong medications into your mouth, please. Our brain is very delicate, and this whole thing about ADHD is about the brain. This is a fabulous organ. God most merciful has given us such a magnificent brain. It is such an incredible, it is a sacred organ. Let's look after this organ. It is a beautiful organ. Let's cherish the organ that your child has got. Motivate your child, encourage your child. That child doesn't know what's going on. That child is coming on in the world in 2024 and say, what kind of a world is this? There's war in the Middle East, there's war in Ukraine, there's a COVID. So these children are panicking. So we need to give them encouragement. We need to give them positive thoughts all the time. Let's not make them even more worse with all the crime and things going on. Let's give them a positive outlook. 90% of the children are very good children. 90% of parents are very good parents. 90% of people are good and hardworking. We just need to share knowledge. So let's share knowledge. So let's get to the medication. So please note, the caveat is always speak to your doctor if you take any kind of medication. And my philosophy is, let's remove the stigma from the concept, whether it's ADHD or autism spectrum disorder. So the stimulant drugs can include two broad categories: amphetamines and the methylphenidinates. So the amphetamines includes things like dexedrine, Adderall, midasis, and Vivency, right? And the other ones include Focalin, Concerta, Daytrana, and Ritalin. Ritalin is many people are familiar with Ritalin. Okay, so these are just general guidelines. It depends what your doctor is giving you for your child. If it takes some time for you and your doctor to find, it'll take some time for you and your doctor to find the right dose. It's a trial and error. It's experimental. Each child is different. Your child, depending on the weight of your child, depending on the behavior of your child, you need a different dose. You need a different dose. You may need different medication, because each medication has got different chemicals inside. So maybe this one may not work. You try something else. Maybe that one may not work. Try something else. Change the dose. Put it higher, put it lower. That's why feedback is important. Keep a journal entry. Take the diary with you when you go to see the doctor. Say, this is what happened. When I gave this medication, this is what happened. When I gave that medication, this is what happened. So that feedback with the doctor, very, very important. Some medications have got side effects like headaches, and maybe they lose the appetite. Although alternative treatment, there's no guarantee that alternative treatment may help. Some patients have shown that maybe yoga helps them or meditation helps them. You can see exercise is very important. So please get your child involved with some exercise. So the main thing is behavioral modification. Stay well, look after yourself, and let's share knowledge. Alhamdulillah. Today we finished. This is episode number 9, and look forward to seeing you in episode number 10, 11, and 12. Inshallah. Alhamdulillah.